But this is truly a presentation about mental health. So that's where this is all headed. We're going to get into some things that might be new, hopefully are new. And there might be some things that I speed through a little bit quickly. I really want you to get the slides and the references after. If I go through a couple slides quickly, it doesn't mean that it's not important. I put together a reference list. It just means that I want to focus on things that will feel most important to you. I am a functional medicine practitioner and a scholar. You can find my work on drdavidwiss.com or Google Scholar. I built a mobile app for mental health. It's Wise Mind Nutrition. My PhD is from UCLA in the Community Health Sciences Department. I did some mental health research. I am a practitioner in the private sector, meaning that insurance really doesn't cover the work that I do. And we'll talk a little bit about that maybe. So I'm like forced out of the healthcare system. And I'm a registered dietitian and I'm from Los Angeles. You can see that picture on the bottom is my inner child, 1991. Before we talk about the commercial determinants, and then we're going to get into some topics of food crime. Ultra processed foods is where this is really headed. Mental health. I want to introduce a new term, nutritional criminology, justice. I don't know if we'll have time to get into the eating disorder stuff, but I'm presenting a lot of this information to eating disorder professionals because there's just a lot of contention in my space, and I am a peacemaker. I'm truly a peacemaker. That is my goal. I try to neutralize charge. That is really what I do. So I want to take a minute to recognize my privilege. If anyone wants to join me in doing the same, we're going to be talking about some pretty big money stuff, okay? And I want to create a little bit of a dichotomy first. It does seem, that there's a lot of dichotomies in our world today. And one of them that I noticed, there seems to be a pattern of people that are just kind of like happy with the way things are. Maybe they have a vested interest in the status quo, but like there seems to be not a lot of interest in challenging a lot of the mainstream thought. And then there's people that are just deeply dissatisfied, don't feel safe, and want to figure out what's going on behind the scenes. Sometimes these folks are called conspiracy theorists. And then, of course, everything is on a continuum and there's a spectrum of in between. So I want to just really try to set the stage for where this is headed. I want to play a little bit of an exercise, and I want you to just pretend for a second that there was a narrative that you wanted to promote and you had a really huge budget. I'm talking about like 100 mil. You had 100 mil and you wanted to get out a point of view. Okay. So let's say there was a Chinese herb company that was awesome and they made really clean, safe products and they started bringing them into the US and the market was responding favorably and people were liking them. And then there was a mega corporation, let's just call it a pharmaceutical corporation, that wanted to promote the narrative that Chinese herbs are unsafe and toxic. The question is, could they do it? With $100 million and a 3-year timeline, could it be squashed? Right? I don't know. Maybe we could start by making a star-studded docuseries about acupuncturists and make one of them look a little bit funky and be all into Chinese herbs and maybe overuse them and get sick and make this person look unwell. We could fund a few papers about their safety and toxicology, maybe cherry pick companies that we knew had low quality and just start cranking out papers about these herbs. We could do some really serious PR work to disseminate these findings, not just in the popular press, but podcasts. We could get some PhDs to put on webinars to warn people, maybe by harnessing some of their pre-existing concerns. We could lobby the AMA to implement more screening, protection, policy fact sheets, and then we could just buy the herb company, divert sales to the non-US. So when you study the commercial determinants of health, you start to see how much can actually go on behind the scenes. We all know the social determinants, right? The conditions where people are born, live, learn, work, play, worship, and age that affect health. We know about factors like household income, employment, housing, all of which are linked to matters of gender, race, and culture, which create a lot of charge. And these social sciences, sociology, life course, epi, social psychology, this is my training, my background, have championed understanding how upstream non-medical factors affect health, well-being, and quality of life. But in capitalistic societies, we need more frameworks. We need more models, more comprehensive ways of understanding how economic influences and incentives can impact health globally. So the commercial determinants are defined as the systems, practices, and pathways through which commercial actors drive health and equity. And I just want to invite you, I'm going to just go ahead and say it. This is the most important piece of scholarship that I've ever read. I've never experienced anything above it. This is global scholars that put together their efforts, and this is a series in The Lancet. And it's one of those papers that I spent an hour reading. It affected my sleep. Okay. And I came back and read it again a week later with the highlighter, and I started making notes. And to me, I just want to pay respect where I think it's due. This is the top of the top. All right. And there's some information in here that allows us to think about how these commercial actors shape political, structural, and cultural environments, specifically in ways that affect health. So they're called actors because these entities rarely act alone. They get support from a diverse range of other powerful organizations, some of whom they are funding and directing, often in hidden ways. And this gives an aura of independence. So commercial actors and other public institutions do seem to benefit from and work hard to maintain the status quo, right? Everything's fine. There's nothing wrong. It's business as usual. Leave us alone. Right. And so again, there's people that are interested in protecting the same old same, and there's people that want change. So the commercial determinants of health identifies the role of these increasingly powerful transnational corporations that dominate unhealthy commodity industries. We're talking about tobacco, alcohol, and ultra-processed foods. As a dietitian and researcher, my interest is in the ultra-processed foods. I assume that you guys are aware of the NOVA classification, which is a system built in Brazil, incredible work done that's been around now 15 years, that classifies food into minimally processed, which is category 1, processed culinary ingredients, which are things that are added to foods like sugars, salts, fats, etc. Category 3 are processed foods. This is a combination of category 1 and category 2. Like most food we eat is processed, but there's a clear distinction between processed foods and ultra processed foods. These are foods that contain little, if any, intact identifiable food groups, and are usually made by a series of industrial practices that someone can't create at home. And I think about them more as corporate branded snack products that are made for profit. Other industries or commodities include gambling, social media, palm oil, fossil fuels, and weapons. Rather than replacing the social and political determinants of health, this model draws on these to highlight how commercial entities interact with determinants to shape health. The perspective might give an impression that this view is against the entire commercial world, but the concerns are really more directed at specific actors and forms of commerce that are harmful to health. So it's really about health. It's not about the overthrow of capitalism. It's about rethinking social progress and the role of commercial actors in it, and really about rebalancing power asymmetries. So we know these commercial actors are increasingly empowered to cause harm and to externalize their costs. So we have all these countervailing forces that have to meet these costs. We're talking about people, governments, civil society organizations. If you think about like Greenpeace going up against the oil companies, society ends up paying to treat non-communicable diseases, address social harms of addiction, to clear up oil spills and plastic waste. And in some instances, communities and countries even can become impoverished, disempowered, and or captured by commercial interest. Power imbalance continues to grow, and it perpetuates the problem. So here are the practices of these commercial actors. Politically, there does seem to be ways to secure preferential treatment and by preventing, shaping, circumventing, and undermining public policies. This one's always difficult for academics, and I've argued with people that see science as a religion. in some ways. But when you really go behind the scenes, you learn about how corporations can produce and use science to secure favorable outcomes, to distort the peer review process, ghostwritten reports. You guys know that, if someone has a real obvious conflict of interest, they have to disclose it on a manuscript. I've written some manuscripts on ultra processed foods where it seemed like the peer reviewers were fighting it really hard. And there was once a situation where I asked the journal editor if the peer reviewer had any conflicts of interest to disclose, and I didn't get an answer. I got a sense that if industry has salaried employees, they can just put them on journal editorial boards and just basically, do whatever they got to do to manipulate science in their favor. Of course, there's marketing, promoting the services, products that exaggerate structural inequalities, targeting specific geographical regions and population subgroups by ethnicity and vulnerability. Of course, there's labor and employment issues when corporations outsource or go offshore, destabilizing communities, financial stuff, tax avoidance, evasion, mergers, acquisitions, buyouts, price fixing. And then the area that I'm super interested in, and this is particularly relevant in the nutrition space, is reputational management, different ways that people shape legitimacy and credibility, reduce their risk, and enhance their corporate brand image, sometimes through voluntary corporate social responsibility. Often these are just PR exercises, tax-deductible ways of shaping policy outcomes. They often promote misleading perspectives to gain appropriate credibility. I remember, when I was newly a dietitian in my first few years, there was a huge outrage from my field because my parent organization, the Academy of Nutrition and Dietetics, entered into a corporate agreement with Kraft where they put our logo on the Kraft single, and it was like, it says eat right, endorsed by, the dietitians of America. And people in my field were outraged because they never asked us. They're basically putting our credential on the line to basically promote the bottom line of a corporation. So reputational management is all about manipulating norms. These are social expectations, often unwritten, about how individuals, communities, and organizations should behave. The commercial actors seek to shape these by amplifying perspectives that align with their agendas. So yes, there are some PR firms that are known to be hired guns for corporations. They're very, very smart. They have very, very clever tactics. And I think as public health folks, it's important to know that, the pulling on emotional strings to override logic, they are very, very effective in what they do. And I'm going to give you guys some examples. Hopefully you've heard of grassroots organizations. Has anyone heard the term AstroTurf? Fake grassroots organizations that are created by industry. You could see this coming out of, for example, the Center for Consumer Freedom. You look at, this is a nonprofit devoted to promoting personal responsibility, protecting consumer choices. When you go behind the scenes, you learn that this was funded by Philip Morris, Coca-Cola, PepsiCo, etc. And, people like personal responsibility, but they form these fake smokers' rights groups. These are groups that are opposing the nanny state and really getting people to fight for their rights when really they're just protecting these corporations' ability to make endless profits without regulation. So they're able to marginalize dissent in very clever ways. For example, the term litter bug was actually coined by the plastic industry. They were smart enough to know that people were concerned about plastics, so they created this term to really put it back on the people. Don't worry about what we're doing at the factories. We need to be worrying about you litter bugs out there. Food police, which is a term that's pretty popular in my field as an eating disorder dietitian. This idea that no one wants the food police around. These are all things that actually support the bottom line of big industries. So they frame problems, possible solutions in their role. You think about the quote unquote obesity epidemic, and they created all these different websites and front groups. If you've ever heard of the Calorie Control Council, it's really just getting people to focus on counting calories as a way of exonerating them from concern about their ingredients. Drinking and smoking eating responsibly campaigns that tend to point the finger at the problem users, the pharmaceutical companies that overwhelmingly framed these issues as poor individual choices. We know how that story ended. They're able to amplify voices that are singing their song. And this is done through media, social media, think tanks, PR organizations, etc. There's a dietitian, and she's done some really good social justice work, speaking up on behalf of marginalized groups, people in larger bodies, particularly in the Black community. She had a point of view that all this nutritional elitism is racist, and it's actually a really good perspective. But here's where it gets interesting. There was a lot of pushback on ultra-processed foods, this year, and they were able to find a interviewer. They chased her down, and they wrote an article about her being an advocate for ultra-processed foods. You get it? And if you were to read the comments, you could see everyone was like, this is clearly Big Food's agenda. You know what I mean? Like, this is PR. And I think that she's an outspoken person, but I saw her get dragged through the mud because they basically found someone that had a perspective that they wanted, and they amplified it. They threw gas on it. In doing so, this entire ecology of misinformation gets developed. So we have these increasingly powerful transnational corps that are responsible for escalating rates of avoidable ill health, planetary damage, social health, inequality. And this happens when commercial actors have more economic wealth and power than national governments. For example, Walmart has higher revenues than Australia or Spain. ExxonMobil has more revenue than Belgium or Mexico. So when we start thinking about commercially driven ill health, it results from a pathological system in which dominant commercial entities are enabled to influence societal norms and values, basically enabled by a media that increasingly represent corporate interests, political and economic systems of neoliberalism, which is a free market ideology. And I'm certainly not against, again, all of these ideas, but it's the way that they get skewed and biased toward certain predictable outcomes. This ideology promotes privatization, trade liberalism, deregulation, tax reductions, all things that sound great. Limited liability. They promote competition, but lead to really monopolies and oligopolies. Yeah, they do this through think tanks. I don't know if anyone's heard of the Atlas Network or the Reason Foundation. These are think tanks that exist, and they influence business schools, basically shape the way things are in favor of profit. We know that it becomes harder to pass policies that protect human and planetary health. We're seeing biodiversity loss in the environments, income disparities and dependencies. And then, of course, we have surveillance capitalism. This is when personal information is collected and sold to refine algorithms and modify human behavior for both commercial and political ends. Switching gears to the commercial determinants of mental health. There was recently an umbrella review, which basically takes all the reviews. There were 65 total from low, middle, and high income countries, looked at tobacco, alcohol, ultra-processed foods, gambling, social media, fossil fuels. Depression was associated with all 6. Suicide, all except for ultra-processed foods. Anxiety was linked to climate change and air pollution. Self-harm was linked to social media. And the studies that looked at tobacco, alcohol, and ultra-processed foods all highlighted the role of inflammation in linking these commodities to mental health. I've done quite a bit of work on the biological embedding of trauma, the biology of depression, and how a lot of different nutrition and nutrition-related factors affect the gut and the brain. This particular talk isn't about the biological mechanisms, but if you are interested in going into deeper dives about nutrition and mental health, I have some other recorded presentations on drdavidwiss.com. Mental disorders are at the top of the list of the most costly conditions. We're talking about over $200 billion per year here in the US and growing. This is from direct medical expenditures, lost productivity, premature mortality. And I really want to shift gears and talk about a recent book by Dr. Matthew Robertson. He's done some academic publishing as well. This is about food crime, which can be defined as acts of deviance that are legal yet immoral, but violate acceptable social norms by these actors and organizations that are involved in the growth, production, sales of food products. This is what we know as the food system. According to Dr. Robinson, these cause more deaths and injuries than all street crimes combined. It exploits and reproduces inequalities and inequities, and that this war on drugs doesn't actually target the substances that cause most harm in society. We know for sure that food companies are far less concerned with public health than they are with private profits, and that is by design. We know that corporate interests can make campaign contributions to both parties, and the amounts and sources don't have to be disclosed. This is what we call dark money. Good example is school lunch policy, seeing how these are very widespread applying policies. I'll share this. When I was a dietetic intern, I had to do hours to become a dietitian. And I remember really being bummed about like food service. And I worked in a school cafeteria, and I didn't love it because I knew I wasn't able to make a real change there, and I went to some food service meetings. I learned a lot. I saw food companies marketing to the food service directors, and I'll never forget, there was a policy that said we want to promote whole grains, and all these companies built these products that were 51% whole grain, 49% white flour. We're laughing. It's just like the white flour. We got away with it, as if they cared more about their profits than the kids' health. I'm actually glad that I had that experience because I now know what I'm up against in the nutrition space. There's a revolving door between industry lobbyists and federal regulatory agencies, which means that people work for the government and then they get a job for industry, and then they come back and work for the government. And this allows for this inner circle, in cahoots type of energy. If you're curious to know more, check out Open Secrets, where you can follow the money. There's some really good resources for you to see about financial data that is disclosed. So we live in an era where food has become industrialized, corporatized, monopolized, and globalized. The driving forces are profit, productivity, competition, where the big drives out the small, innovation, product differentiation, corporate mergers and acquisitions. The classic examples we know is that tobacco companies, when their sales started to decline, they started purchasing food companies. We'll talk about that. And I think a lot of people don't know this, but as smoking went down and vaping went up, guess what happened? You guys know that Juul and all those vaping companies are owned by the tobacco industry. They just bottom out. This is how the game goes. They stay wealthy. They stay one step ahead of the game. Whoever has the best data wins, and they have access. There's a long history of small companies selling out to the larger, and I mean, you can't blame them, right? Annie's Homegrown started in 1989, sold to General Mills for $820 million. Applegate Farms sold to Hormel Foods. Ben & Jerry's sold to Unilever. Kind Snacks, owned by candy company Mars. And of course, there's companies that chose not to sell. Bob's Red Mill, Cascadian Farms, Strauss Family Creamery, In-N-Out Burger. So you kind of get a sense of, I might choose the family-owned businesses rather than the corporate ones. These are ways that I choose to vote with my wallet and to vote with my fork. I don't know if anyone's seen this chart, but this is basically a resource. It's from 2013, so I'm pretty sure there's been some acquisitions and mergers that have changed a few things around here, but get a sense of the illusion of choice that we have. You walk down the cereal aisle and it looks like you've got a couple different choices, but they're all owned by Kellogg's, for example. A lot of times corporations are smart enough to buy smaller companies that seem like they're interested in important social issues, and they're able to do that to create a profile of corporate responsibility per se. But go ahead and check out Oxfam America. It's known for advocacy against corporate practices that contribute to inequality and poverty, like workers' rights, supply chains, environmental sustainability, labor conditions, land rights, etc. When you look at the history of class action lawsuits against food companies, there were 19 in 2008, 325 in 2021. And you think about class action lawsuits against A&W for saying Kraft with aged vanilla. There's no real vanilla. Canada Dry, made with real ginger, Kellogg's, strawberry, no real strawberries. McDonald's and Burger King have these toxic fluorinated chemicals in their packaging. These are PFAS, also known as forever chemicals. Very, very real concern. So we have some very well-established known harmful agents, antimicrobials in the feed, which leads to antibiotic resistance in humans, gut dysbiosis, a lot of which can be linked to glyphosate, aka Roundup. This is the major pesticide used by Monsanto, now Bayer, that has just a long history of health harms that they seem to be able to get away with. I just want to touch on the food babe for a minute. I'm a dietitian and, I do eating disorder work. And I just want to say that when I was new to the field and new to the Instagram and I saw her, my natural reaction was, ew, she's not even a dietitian. I'm the real deal. And she's not. She's just one of these influencers. And I naturally just had a disdain for her because it seemed like she was just promoting what people call fear mongering and orthorexia nervosa. Yeah, I just wanted to say that out loud. In the last year, hearing her speak in front of the Senate and actually checking some of the ingredients, I changed my mind. All right. I changed my mind about someone. She's been a very vocal food activist and she's talking about some very important issues about foods that are in the food supply that are linked to a wide range of negative health outcomes that are banned in Europe and allowed here in the US. When you think about that, you got to wonder, do these food additives, do they actually create that much more profit that it's worth it for the companies to do? Or is it possible that there's some even chemical warfare going on for the sake of keeping us in the healthcare system? Supercharged issues, I'm well aware. And, just want to really highlight that these are global issues that it seems like in the US, we are just so far behind. And a lot of people are confused why. We have other known harmful practices, animal welfare, working conditions, disposal of waste products, greenhouse gases, airborne pollution, decreased soil fertility, erosion of land, increased flooding, crop resistance, species decline. And then we have food fraud. I don't know if anyone's heard about mislabeled fish, fake honey that's actually corn syrup, olive oil that's cheaper oils combined. Fortunately, we have ways of learning more about some of these third-party tests that can be done and some of the results. It's kind of a bummer when you get an email and you find out that a bunch of avocado oils on the market are fake. And you just wonder, how is that okay that they can continue to get away with this? There's other marketing practices like funding one-sided studies that always prove points about quality safety, cast doubts on findings that threaten financial interests. I don't know if anyone's heard of the term front groups. These are basically groups like we talked about, AstroTurf organizations that are funded by industry that have a very clear goal of controlling a narrative. So for example, International Life Sciences Institute is a nonprofit that was started by Coca-Cola behind the scenes back in the late 70s. Just goes to show you how smart they've been for how long. They funded this physician researcher to basically do a lot of studies that focused on exercise rather than nutrition, calories rather than ingredients, IFIC. And these companies have been around a long time, so they have really good SEO. So if the public goes and searches for information, you might end up on one of these websites. Come to find out, the website's owned by General Mills and McDonald's, or funded, I should say. So there's a lot of deceptive advertising where micronutrients are enriched and fortified, not actually in the food. We have product shrinkage, and there's a huge buzz right now about ultra-processed foods. This idea that they are harming global health, implicated in the rise of many non-communicable diseases through early life effects, having an influence on our stress responses, taste preferences, and our microbial inner ecosystems. If anyone's interested in more, this artwork is actually done by Susan Prescott, who's a part of the Nova Institute, and they put on some really cool events. I recommend checking them out. It's really about environmental health, thinking about how foods and diseases link back to gut bacteria, diarrhea and inflammation. This is sort of the biology part of the picture that I've been talking about for many years, and I think is important to understand. So we're not just doing social science. We have mechanistic data. This is from the Lancet 2022 that maps out what percentage of calories are consumed by ultra-processed foods based on that NOVA classification I gave you. And you could see here that the US, we are world leaders in ultra-processed food consumption. My work, and I've done quite a bit of research on ultra-processed food addiction. Again, another supercharged issue. I tend to lean into the charged issues if you haven't noticed. The more recent systematic review suggests that 14% of the general population meets criteria for ultra-processed food addiction. Interestingly, this estimate closely mirrors the prevalence of substance use disorder. So you could see right there in the teens, 14% of our nation is quote unquote addicted to food, approximately 12% among children and adolescents, which is a level of addiction unprecedented among the youth. But when you start looking at specific groups, right? Low income, reproductive age women, you see reports of Black women having a higher scores than Hispanic women. We have nationally representative data that shows the prevalence being the highest among Hispanics, Blacks, Asians, whites. So you start to see some very clear disparities based on SES and other racial, ethnic, cultural factors. Most people have heard the term food deserts, and this describes areas where there's not a lot of good access to food. But the more recent term that we've come to is called food swamps. This is where ultra-processed foods inundate healthy alternatives. And I think this is a really perfect example of how narratives can be controlled. This well-cited paper took food outlet data, socio-demographic data, BMI data, and found that the presence of a food swamp is a stronger predictor of higher BMIs than the absence of full-service grocery stores. So you could see how the concept of a food desert almost panders to the social determinants of health. People don't have access, they're food insecure, they don't have grocery stores. Whereas this idea of a food swamp being a bigger predictor of BMIs, for example, one health outcome, really puts focus on the commercial determinants of health. It's the over access. And also thinking about how these commercial chains will drive out the small family owned business. In the little shopping center where they have Del Taco and Subway, it's going to be hard for the mom and pop business to survive. Coming back to nationally representative data, we know that ultra-processed foods is close to 2/3 of calories, even higher among teenagers and adolescents. Yeah, these percentages reach all social strata, but they're greater among the less educated, younger, and lower income groups. In one study in Sweden, 1/3 of all advertisements promoted food. Of those, more than half promoted ultra-processed food. So these are unhealthy commodities that are disproportionately targeted toward vulnerable groups in low SES areas. Now, here's where it gets interesting. If you look at the history of Kraft, I shared earlier that Philip Morris had purchased them at one point. This is a great paper from the American Journal of Public Health that looked at how ethnic and racial marketing strategies were transferred from tobacco companies to food companies. So in '85, Philip Morris purchased General Foods and then later purchased Kraft, created Kraft General Foods. And these were internal documents that leaked. When they were sold, they had a quote unquote fully integrated minority marketing program that combined targeted marketing with racial and ethnic event promotion, media outreach, with corporate donations to leadership groups. We're talking about targeting vulnerable communities, Kool-Aid to Blacks, Hispanic targeted flavors of Tang. And, they used the same playbook that they had. For example, there was a very clear marketing effort of Newport cigarettes to Black communities. When you look at food insecurity and ultra-processed food addiction, coming back to our NHANES data, this is over 9,000 individuals, below 300% of the federal poverty level. More food insecurity was associated with higher intakes of ultra-processed foods. These aren't things that are surprising. Sometimes we have to document things that we already know. SNAP participation was associated with a higher intake of these foods. 2 samples of low-income female adults. Pregnant women from food insecure households had 20% higher addiction symptoms than non-food insecure households. And interestingly, their caregivers had really high rates of ultra ultra processed food addiction. Other nationally representative samples show that ultra processed food addiction prevalence was around 7, food insecurity around 51. After adjustment in their models, the food insecurity was associated with nearly a 4 times increase in the odds of ultra processed food addiction. Didn't differ by age, gender, race, ethnicity. The most problematic foods were chips, non-diet sodas, chocolate, pizza, ice cream, all the stuff that most people tend to enjoy. Thinking about food insecurity as being a chronic stressor where someone is perhaps socially disadvantaged and more inclined to seek comfort foods. So when you combine chronic stress with maladaptive eating in a pernicious food environment, what you get is a perfect storm for increased BMIs. This is one of my papers from 2020 that looked at how stress, trauma, and adversity can get under the skin and how that is linked to SES and the food environment, thinking about the link between trauma and addiction like eating, how that can contribute to increasing BMI and the biology of it all. And then, of course, as an eating disorder clinician, I'm always thinking about the role of weight stigma, how that's its own stressor. That drives dieting. Dieting drives loss of control eating, and thus the cycle continues. So this is an example of a biopsychosocial model where you could think about the biology of these conditions, the psychological factors in the person and in society, and then, of course, the social and environmental factors. This is how I was trained in public health. Actually, not really trained that way. This is how I learned to think, to always think about mechanisms, always think about cognition and mindsets, and then to always think about the environment. So what can we do about ultra-processed foods and addiction-like eating? Of course, we can start by assessing the disproportionate impact on disadvantaged communities, test the value of industry-focused public health messaging to reduce ultra-processed food addiction, push back on ultra-processed foods in healthcare systems like in hospitals, white bread, cakes, concentrated fruit juices. Of course, we need those foods for people that can't swallow well or can't eat a lot of fiber, but we don't have a lot of other alternatives for people that need real healing. Also, eating disorder treatment centers. Also, taking a moment to recognize the privilege of people that have higher SES who can easily offset the effects of ultra-processed foods by consuming a wide range of health-promoting products. So if you think back to ultra-processed foods, like if someone is eating a lot of fruits, vegetables, whole grains, beans, nuts, seeds, organic animal products, etc., having, 20% of their intake be ultra-processed foods, nutritionally and biologically is very different than someone who eats 80% ultra-processed foods and 20% quote-unquote real food. So these are important things to think about. Switching gears to mental health, we're going to get into some hopefully interesting new stuff for y'all. My work in the last few years has been largely focused on nutrition and depression, mostly because that's where the most data is. We have 7 randomized controlled trials that show nutrition interventions can improve depressive symptoms. These are not weight loss studies. Just wanted to highlight this recent paper. We're talking about really high quality data, longitudinal data with multiple points in time showing dose response findings. Higher consumption of ultra processed foods at baseline associated with higher odds of persistent depression, higher risk of incident depression over the 8-year period. And then, interestingly, we have some cool studies linking ultra-processed foods to mental health. This particular study identified sweets, beverages, fast foods. Quick side note, I think this comes back to the commercial determinants of health. As I've done the deep dives on the literature on nutrition for mental health, one really interesting thing that I picked up on is that almost none of the studies are here in the US. When you start thinking about that, why? Why is it that all of these come from other countries? And the answer is usually because they don't get funded here in the US. And then you ask the question, well, why doesn't nutrition for mental health studies get funded in the US? And then you start to think, there must be an agenda with the pharmaceutical industry squashing efforts to promote nutrition as a tool to leverage mental health outcomes. And then you start to make sense. The commercial determinants of health. In this large sample from minors in Iran, frequent junk food associated with psychiatric distress, violent behaviors, fighting, bullying, etc. We know that antioxidant, carotenoids, and fiber inversely associates with aggression among girls. The strongest negative correlation was found between aggression and dietary fibers. There was an inverse correlation with aggression and beta carotene, alpha carotene. Another related study showed similar things: simple carbs, types of saturated fats, caffeine, all predictors of aggression. I want to take you to a large study in Taiwan. This was of 5-year-olds and their parents, showing the associations between maternal education and physical aggression in the offspring, and then looking at the mediating factors. We know that more education in moms is associated with less physical aggression. And then the question is like, well, how? Why? This is what mediation analysis permits. In one model, maternal education was a positive predictor of healthy eating, which was a negative predictor of physical aggression. In the other mediation model, maternal education predicted poor eating, which in turn was a positive predictor of physical aggression. So thinking about nutrition as a mediator for a lot of these relationships that have been difficult to understand and explain, especially in the food insecurity literature, we know that food insecurity is linked to drug use, and then thinking about what role does nutrition play in all of this. Another study from Greece, these were 10 to 12-year-olds. Eating soft drinks and snacks was associated with higher odds of aggression, loneliness. We know that skipping breakfast is associated with poor mental health. Interesting work here that actually tried to untangle some of the mechanisms, thinking about how breakfasts that are higher in carbs and lower in protein increased certain social punishment behaviors. They had some interesting ways of measuring all of this. This was a well-funded study that actually looked at plasma neurotransmitter precursor levels, thinking about how carbohydrates stimulate a tryptophan effect, which can promote serotonin, tryptophan being its precursor, protein, tyrosine, dopamine. So they actually measured how breakfasts affect neurotransmitters and how that was linked to behavior. So you get where this is headed: nutrition for mental health. There's been a little bit of controversy in the ADHD link. When you think about the controversy, though, why is there controversy in the nutrition for ADHD association? If you really start to think about it from the commercial determinants of health, a lot of the studies show a link, but then there is a bunch of studies that don't. Oh, those were studies that were funded by pharmaceutical interests. They don't want us to know that nutrition can leverage ADHD, because then parents and moms are going to be more interested in dietary interventions than pharmaceutical interventions, which are not as profitable. So the odds ratio, not that high, but noteworthy nonetheless. Junk food and ADHD symptoms. One of the mechanisms is pro-inflammatory cytokines like TNF alpha. The link between nutrition and ADHD is biological, oxidative stress, gut-brain axis, mechanistic, and very important. We have data suggesting ultra-processed foods linked to insomnia. Again, this is in France. Not a lot of US studies going on here. We know that ultra-processed food correlates with internalizing symptoms like boredom, crying, fear, worry, loneliness, unhappiness, poor sleep, sadness. When we think about the biology, there's a lot of reasons why ultra-processed foods link to negative health and mental health outcomes. I'm going to walk you through 10 great references here if you want to learn more. The first is that they displace real foods, right? People that eat more ultra-processed foods eat less of the real thing. These are foods that have a poor nutritional profile, low nutrient density, but there's a lot more to it. There's a lot of harms that come from the packaging. These neoformed compounds that are formed during jarring, other high heat industrial practices, you can get other compounds that are not supposed to be in our food. Of course, we can have inflammatory responses to food additives, things like emulsifiers and preservatives and coloring agents, etc. And then the packaging, the plastic, the bisphenols, the phthalates. There's a lot of things that come along with these foods that are deleterious to our health. We know that these foods often have a higher glycemic load, reduced fiber volume, which is super important for gut health, mental health, microbial dysbiosis, leaky gut, or better known as intestinal permeability, and then of course, addiction like eating. I want to get into a fascinating topic. I think that there's a lot here, and a lot of it has some, personal relevance to me. There's an emerging area of nutrition research called nutritional criminology. And this is now thinking about how ultra processed foods might be implicated in certain mental health issues and neuropsychiatric outcomes, leading to antisocial aggressive behavior. And those, of course, have important links for the criminal justice system. It's kind of bringing the Twinkie defense back. I don't know if anyone remembers, decades ago, there was a big crime and they had a lawyer and they said, this person was unwell and it was all the sugar and poor eating. And society kind of laughed at it. I don't think it worked. But in many ways, the data we have now on gut bacteria, inflammation, mental health, trauma is starting to say, actually, there are some more biological explanations of criminal behavior. We have brain imaging studies looking at the prefrontal cortex, the amygdala, the striatum. And then there's all these hypothesized mechanisms by which ultra-processed foods and drinks can alter the brain through inflammation, affecting neurotransmission of serotonin, dopamine, all these different factors like nanoparticles and trans fats that get into the brain or cross the blood-brain barrier. There's a really exciting area of research called psychoneuroimmunology that really links the immune system to the brain. And then, of course, we have the emerging science of nutritional criminology, thinking about adversity and the biopsychosocial risks. When someone has excessive food insecurity, psychological stress, caloric burden, and then they're just eating synthetic chemicals all day long. Nutrient deficiencies, they might live in a food desert or a food swamp, microbial dysbiosis, inflammation, metabolic dysregulation, environmental pollution, sedentary behavior. And then, of course, there are what we call resilient factors or buffering factors, right? Having better access to fresh foods, dietary diversity, antioxidants, phytochemicals, omega-3s, fibers, all promoting microbiome health, access to green space and biodiversity where people can move, having positive relations and positive emotions. Really cool papers that have come out in the last few years, and mostly review articles that combine microbiomes and other sciences with forensic legal psychology, starting to think about how dysbiosis and SIBO, these conditions of the gut, which link to socioeconomic deprivation, possibly from antibiotics or PPIs or H2 blockers and low stomach acid, have implications for human behavior. The gut microbiome is not only influenced by the host behavior like the diet, but the behavior of the host is also influenced by the microbiota. And this is seen in things like substance use and temperament, impulsivity, aggressive, violent tendencies, emotion regulation, antisocial versus pro-social behaviors. So a lot of pathways linking the gut and the brain. We have, of course, the vagus nerve, gut leakiness. There's a lot of different signaling molecules like cytokines and neuropeptides and hormonal messengers. We also have the gut-liver axis where bile acid is produced and metabolized, and then the manufacture and transformation and absorption of certain nutrients, things like vitamins, omega-3s, fatty acids, and polyphenols. So this does actually have some interesting implications for criminal justice. There's this area called neurolaw, which combines neurology and neuropsychiatry with neuroimaging, neurogenetics, neuromicrobiology, forensic neuropsychology, and the related fields. And some of these advances in neuroscience and microbiome do challenge our assumptions, including notions of our free will. And I think one of the key messages is that criminal responsibility and blameworthiness do not sit on an even plane. That certain people that grow up in certain environments and certain families that have access to certain foods, these are all factors that affect behavior and health outcomes. So to achieve nutrition equity in the US, the interconnectedness of crime and nutrition must be expanded. This is, of course, for researchers, practitioners, and policymakers to be able to develop and implement effective initiatives to improve nutrition and reduce crime in historically disadvantaged communities. We need research on modifying effects of crime exposure and impersonal violence on dietary disparities. And we actually have quite a few studies, small, but this is like the best you could do in a prison setting. And again, non-US environments, looking at prisoners in the UK receiving supplements, multivitamin, essential fatty acids, committing fewer offenses on the yard. Incarcerated juveniles getting multivitamins. Pre and post intervention blood samples show that those who were able to correct their low blood vitamin concentrations had less violent acts during the intervention period. Other studies of adult prisoners combined multivitamins with omega-3, 1 to 3 months, reported incidence significantly reduced. Other studies, 15 weeks, reduced the number of serious rule violations. You have to wonder, like, wow, these are pretty big findings, right? Like, if you could reduce prison violence through omega-3 and multivitamins, then we should be doing it, right? Guess what happened after these studies? Nothing, right? And this is how it seems to go too often. Other young offenders showed omega-3 reduces self-reported antisocial aggressive behavior. A secondary analysis of their sample showed that combining omega-3 and vitamin D got close to a significant finding in reducing recidivism in all 3 years. If you're interested in the link between nutrition and behavior and the mental health of prisoners, there is a recent systematic review. Please go ahead and check that out. So, where's the justice? Coming back to the commercial determinants of health, we do need a consensus around the scale, scope, and complexity of these issues. We need to draw more attention to the magnitude of health and equity harms caused by the commercial determinants of health. And this means amplifying the voices of people that are harmed by commercial actors, protecting whistleblowers, thinking about systems changes, new ways of measuring progress, particularly in healthcare, regulating harmful commercial practices. I've been really vocal about seeing that commercial actors and their opposition to health regulatory policies, exclude conflicted industries from playing a role in policy formation. We need to better scrutinize the ubiquity of corporate norm shaping that's enabled by a media that increasingly represents corporate interests. The norms need to be reshaped in the public interest. We need to denormalize harmful practices, regulations on predatory marketing, prevent tax deductions for certain practices that masquerade as corporate social responsibility, explore, denormalize fraudulent corporate responsibility efforts, and classify them as marketing. The polluter pays principle suggests that if some of these externalities were costed into taxation formulas, then commercial actors would have a less incentive to manufacture and sell harmful products. We need to, of course, think about labor and employment conditions like rules on pay gaps in organizations, reduce reliance on industry funding for academics and researchers, change the way science is funded, stop industry-funded science education, and, of course, a better management of conflicts of interest, improving transparency, exposing industry interference during policy debates, and more ideational change in contesting the status quo, pushing back on ideas such as the nanny state or personal responsibility, civil society groups to raise our collective voices, promoting more scholar activism and mobilized forces. When we think about food justice, there are need for political solutions. Supercharged in the last few months, seeing that there did seem to be, and this is at least how it was perceived by a lot of the public, one party that was interested in this topic and one that wasn't. It left a lot of people, particularly healthcare professionals, deeply conflicted. Subsidizing healthy foods, regulating ultra-processed foods, regulating food additives, promoting crop diversity, better working conditions, more disclosure, banning deceptive marketing, especially to children. And then thinking about the gut ecosystem, since the gut ecosystem is a product of diet and other socioeconomically related environmental factors, including the consumption of ultra-processed foods, the cause of the causes needs to be scrutinized more closely. And I believe that that's what the commercial determinants of health is. We in public health talk about going upstream, looking at the causes. And this to me is truly the cause of the cause of the causes. So the food industry does seem to sit in this really convenient position of yelling stigmatization in a global theater. And this is coming back to the social determinants of health. But my view is that if lower SES groups are in fact constrained in their food choices, then the mega corporations have even more responsibility to ensure that the food is not poisonous and not addictive. And this is when we come back to the commercial determinants of health. I believe that there should be some more government responsibility to protect our most vulnerable citizens. Now, here where it gets good. I don't know if anyone has an interest in being into the nutrition field, but I have a framework to offer you. I want to be super clear. I'm 12 years in the game doing nutrition counseling. It is my career for the most part. I've worked with over 1,000 patients in the last decade, and I've changed a lot of people's lives. And it's because I just do counseling. I don't do meal planning. I built my own app, which is super helpful, but I just talk to people. And one of the ways that I'm able to help people is helping them get in touch with their values. So value-based eating frames healthy eating as being consistent with someone's values. So in this case, 8th graders having the value of autonomy from adult control and the pursuit of social justice. So in this study was a randomized controlled trial. Healthy eating was suggested as a way to take a stand against manipulative and unfair practices of the food industry. For example, engineering junk food to make it addictive and marketing it to young children. So compared to traditional health education or the control, the treatment led 8th graders to see healthy eating as more autonomy assertive and social justice oriented, and they were able to forego sugary snacks in favor of better options. We know that public health interventions are more effective when they harness the motivational power of a group's existing value system. So the approach aligns healthy behavior with values that the adolescents already care about, feeling like a socially conscious, autonomous person that's worthy of peer approval. We know that these traditional self-regulation approaches are very difficult, especially with adolescents, especially with people that have addictions, especially with people that have trauma. And this value-based eating approach eliminates the need to think about the long-term material benefit. It offers an immediate symbolic benefit for resisting temptation. People can feel like a respect-worthy person now because acting in accordance with important social values. Hopefully, some of the dots are starting to get connected when you think about ways that we can leverage change in public health. When you know a lot about what goes on behind the scenes, the environmental impact of foods, some people might be more likely to change their eating simply because they care about some of these bigger issues. Like I said, I might choose some of those family-owned businesses over the mega corporation businesses because I want to root for smaller family-owned businesses. I eat based on my values. I eat some ultra-processed foods, of course, but I don't want to support those companies. I don't. And this is a way of people changing their behavior in ways that are not about milligrams of sodium. Very different type of an intervention. Similar study, same investigator, pointed out that focusing on future health does nothing to counter the effects of ultra-processed food marketing. So these companies not only advertise, but deliberately formulate foods for maximum reward and strategically position them in places that are difficult to resist. So again, this is in a values alignment intervention that emphasizes the social justice implications of food companies' disproportionate targeting of vulnerable communities, including children and the poor. It's a symbolic stand against the injustice perpetuated by food marketers. I feel like I might lose some of y'all in this last section of eating disorders. This is just a little counter argument, which is that one of the major pushbacks against the stuff that I'm talking about does come from the eating disorder establishment, because there is some concern that getting people too wrapped up about environmental issues or ingredients can actually promote some restriction. I'm an eating disorder professional, and I get a lot of pushback for my research on ultra-processed foods. It's the same predictable narrative of you can't do that here because you're promoting diet culture, fat phobia, weight stigma, etc. And we saw the same thing sort of happen in this last election cycle. Similarly, it almost seems like you just can't talk about the food supply without pissing someone off for some reason. But there's a lot of conflicts of interest in the nutrition space. I found an article about conflicts of interest, and I quickly went to see who wrote it. And it was an industry-funded review article that was built to reduce the stigma of commercial collaboration. So my first reaction was, ugh, I can't trust this article. And then I quickly read it and I was like, set that aside and read it. And what I really liked was, while conflicts of interest are generally seen as financial links to food industry, this author offered us this notion that there's other conflicts of interest, like our personal and professional relationships, our own self-interest, our own belief system, our intellectual allegiances. There's people that have, for example, an allegiance to health at every size. And therefore, in health at every size, you don't say negative things about food. It's food positive. So people are being forced to choose, where does your loyalties lie? And then people are conflicted and they end up usually choosing social safety over public health. So there's a lot of non-industry and other professional incentives, career advancement, professional appointments, opportunities to travel, be on panels, etc. It's important to think about that as scholars, right? Think about, what activities and what groups do we associate with that can affect our scientific judgment. We might have bias toward accepting new information that confirms our prior knowledge. We might minimize information that challenges our prior knowledge. We might suppress information that's not as compatible. So in the nutrition space, it's not just the money. It's like the stakeholders, the people that have particular views that they want to promote. So for example, the authors of Intuitive Eating or the promoters of All Foods Fit, they have a great investment in adhering to a particular view and a lot to lose if the view is rejected. So here's my field, dietitians. This is another perfect example of an intuitive eating counselor who was offered, I'm pretty sure it was 5 digits by the Sugar Association to get on their website to promote eating food without guilt. Now, as an eating disorder dietitian, I believe in guiltless eating. I believe in principles of intuitive eating. But when you really think about it, it makes public perception of the nutrition professional low. Dietitians were traditionally perceived as the food police. And now my field, we're more looked at as these industry shills in the anti-diet paradigms. I don't know if anyone saw the WAPO article. It's about a year ago where they exposed dietitians who are taking money from the food industry and making videos that promote sugar and supplements on TikTok, encouraging their followers to eat sugar and candy. And these were people that had a good intention. They weren't maliciously taking money from the industry to cause harm. They were actually eating disorder practitioners who believed that people should stop tripping about food. This report exposed some close ties between food industry, dietitians, my parent organization, which has accepted millions of dollars from soda, candy, and ultra-processed food companies. So we've got this crazy contention in my field where there's dietitians that are always trying to combat fear-mongering and talk about the myths about food and debunking. A lot of it's well-intentioned with the goal of eating disorder prevention, but my view is that some of these messages also invalidate people that struggle with poverty, addiction-like eating, depression, antisocial aggressive behavior, ADHD, and there are forgotten groups that are marginalized by the mainstream nutrition discourse, and it leads to distrust from the general public, and it impacts the entire field. The view in eating disorder world is that all foods fit, stop tripping, don't diet, just eat what you want, and I believe that view is valuable, but it reeks of privilege to me. So our academy has this total diet approach, which says, as long as it's in moderation, you'll be fine. Take responsibility and just do it in moderation. Doesn't demonize specific foods or ingredients, always points to the social determinants and ignores the commercial determinants, and to me comes across as industry-friendly messaging. So the current eating disorder landscape, there's very few treatment centers acknowledging the role of these foods during treatment. A lot of people insist that food addiction doesn't exist. Some people see it as a harmful concept, believing that it stimulates unwarranted fears and rules, give very little attention to food quality, and discourage any sort of food avoidance. It seems to be that these social and psychological factors like media influences and weight stigma are considered more important than the biologically based behavioral responses. And in their defense, I would say that most people assume that the food environment's not going to change. We have to just learn how to live with it. But myself and many others are saying, actually, no, we can change the food environment. My view is that once we clean up the food environment a little bit, there'll actually be less eating disorders, not more. It's taboo to talk about food quality in eating disorder world or on social media. You get attacked. People get called orthorexic and that they're perpetuating restriction. And it turns out that a lot of people are asking about addiction-like eating. People have questions about ultra-processed foods, often getting getting gaslit by practitioners. Professionals want to know about receiving training. So we have a very clear unmet need that needs to be addressed. Funny paper, and in the eating disorder space, one of the major components of treatment is to not have black and white thinking, to be non-rigid, to be fluid in your ways of thinking. But if you actually look at how clinicians and researchers in the space behave, it's very black and white. It's very rigid. It's very, you're either with us or against us, in group, out group. You either say it our way or you're not part of the club. And it's created a very toxic culture, heightened by political unrest. People have a personal bias based on their own recovery, allegiance to a certain group. My view is that groupthink is very helpful to practitioners, but very harmful to patients. When everyone comes together and says, this is how we see it, this is how we think, it makes it easy for everyone to be a part of a club, but it's not actually what helps patients the most. And this is, in my opinion, a significant under-discussed conflict of interest. I've done a lot of work on this eating disorder mindset versus the food addiction mindset. And eating disorder is just centering on an assumption that the more you try to avoid a food, the more likely you are to crave it. Food addiction centers on an assumption that the more you eat the food, the more likely you are to crave it. So they're very different and seemingly polarized models, where eating disorder sees restriction as the driver, that restrictive eating is what drives the binge, and food addiction sees consumption as the driver, that the actual addiction is why people might diet or restrict. Eating disorder mindset emphasizes the psychological and social factors that contribute to body ideals of thinness, and food addiction emphasizes the neurobiological factors of each individual that contribute to problematic eating. So eating disorder seems to be more interested in weight stigma and diet culture, where food addiction actually is concerned with the food environment, the way that food changes the brain as key drivers. Eating disorder looks at the forest of the diet rather than the individual tree. Food addiction recognizes how important individual trees can be in the forest ecosystem. Eating disorder teaches all foods fit and inclusion. Food addiction understands that some foods can be triggering and are better excluded. So it does seem like eating disorder philosophy teaches acceptance, how to navigate the system we live in, whereas food addiction emphasizes change and ways to opt out of the system. Eating disorder doesn't see food environment as a target, but food addiction sees public health policy regulating food manufacturers as a target. It almost feels like eating disorder is centered on the social determinants of health, whereas food addiction view is much more interested in the commercial determinant. Eating disorder looks at weight stigma as the social justice issue, whereas food addiction looks at the prioritization of private profits over public health as the important social justice issue. So eating disorder believes that changing anti-fat attitudes is the solution. Food addiction believes that challenging corporate greed and political power is the solution. I've been stirring the pot in the eating disorder community. We recently published a comment dismantling the myth of all foods fit. I've been very interested in peacemaking in the field because it's just so unsafe for so many people, especially someone that has any sort of dissenting views. To bring it home, ultra-processed foods are troublesome from social, cultural, economic, political, and environmental points of view. We have emerging data that ultra-processed foods are linked to compromised mental health across the globe. These are foods that are produced for corporate profits at the expense of public health. We know that the changing human brain is more susceptible to convenience and the overvaluation of neurochemical rewards, especially when distressed. We know that the domination of these foods and their processing have replaced traditional eating patterns, and that worldwide trends in eating disorders and other mental health disorders parallel this transition. And this hopefully was the key message that you got from me today. We can help people eat in ways that are closer aligned with their values and to recover from disordered eating at the same time. Until we can mitigate the corporate capture of the nutrition field and regulate big industries, we're left fighting amongst ourselves about divergent food philosophies, whether or not we should be talking about these foods in treatment and recovery. And I would say that they embody equally important and overlapping social justice implications. It does seem like we're in a world where people are making you pick one issue versus the other. I think we need to get into a world where we start working together, joining forces, needing more lieutenants rather than warriors. My view is that nutrition is a major unspoken tool of oppression in society. Weight stigma, diet culture are important social justice issues. They're very supercharged because they link to other social determinants. I believe that understanding the social determinants is critical, but further upstream are the commercial determinants. Diet culture needs to be tackled, but we need to go upstream and tackle corporate greed, the toxic food environment. Calorie counting, BMI tracking are not the solutions. We need to shift the focus on more qualitative measures, things like the quality of the food, quality of life, etc. To bring it home, the stuff that I've been screaming from the rooftop, the hills that I'm going to die on, I believe nutritional deficiencies and the associated biological consequences should always be addressed before any new psychiatric diagnoses are made and medications are prescribed. I believe that nutrition is not alternative medicine and that corruption in healthcare must be stopped. My hope for nutritionists is that we can be a little bit more dialectic, more non-binary in our thinking, stop the infighting, do better as a field, rethink, reinvent, reposition. Our patients need better. Our nervous systems need better. Our guts need better. Our brains need better. And of course, the environment deserves better. So I'll meet you there in the real world where we do evidence-based medicine, free from conflicts of interest, justice-oriented, and forward-thinking. Check out my app, which is a no-cost, low-cost option to use nutrition to improve mental health. You could certainly find my private practice website, scholarly website. Here's all my contact information. I do appreciate your attention.